Okay, let's talk about some of the options you may not have tried yet. If you go ahead and try to fix the problem, we'll start in the middle one here, indirect decompression. That's something called the Vertiflex. If you want to stop the pain at the source, that's a nerve burn, radiofrequency ablation, very common for neck, back, thoracic spine pain. And if you want to try to stop the signal of pain of the brain, that's down here at the bottom, spinal cord stimulation. What is a nerve burn? Radiofrequency ablation is very common. I've been doing it since about 1995 when it started to become more popular. It was found that small sensory nerves can be ablated. And that means that you can go ahead and trim them like a bush. Just like you'll have to go out soon if the weather stays like this and start mowing the lawn and trimming up the gardening around your house. The same thing is done with people that have bad arthritis in the spine. In the lower picture here, this lower picture, you can see that this is a side view of a spine. And the spine has two nerves that come off right away, and they're both mostly sensory. So you can block that by putting local anesthetic on there. If you can block it, then you can burn it. This will grow back in 6 months to a year. There's ablation type techniques that are done in the clinic with a needle. And there's also bigger techniques that are done in the operating room where a pencil-sized device is put down with an endoscope right there on the top of the nerve. And by doing that, you can go ahead and burn that nerve even more effectively and get a much longer pain relief. This kind of patient is usually the one that has to bend over and push a shopping cart that's empty while they walk through Meijer or Walmart. The reason being is that if you start to unload the back of the spine, people feel a lot better. It's important to notice that because now every time you guys go into a grocery store, you'll see all these grocery carts being pushed with nothing in them. And that's what you're seeing is that people lean forward in order to make their back feel better. The nerve burning techniques are done for other things besides the spine. They're being done for knees, hips, and the neck also. And the benefits are really great for people. So stopping the pain at the source is a great way to use with radiofrequency ablation or nerve burning. Once again, these nerves do regenerate, so it has to be redone. Most insurances will have you test the nerve twice before they allow a burn. So those are all the hassles that come into having this done. But as far as hassles go, it pays in dividends once you don't have to take medications or you can walk standing upright. Let's talk about another way to help people stand upright. This thing right here on the right-hand side of the screen is called a Vertiflex. A very fancy little device, very simple. Here's a side view of your spine. Right here you can see the joints that get all arthritic in people. Right here you see the nerves as they come out and they start making their synapses with other things that go all through your body. Here's the vertebral body. Here's the disc. And this little thing right here goes into the spine and it makes it so that when you stand upright, these holes don't get crushed. So people that can only walk so far before they have to sit down, and sitting down relieves it. And that's very important for this device. Sitting down really has to relieve it. You can put this in and it's almost like you're sitting down all the time because this helps take some of the pressure off these holes here by pushing this part open. The incision is about the size of my finger, this way. And it takes about 10 to 15 minutes to do. Downtime, we don't want you doing a lot of bending after something like this, but to tell you the truth, most of you stay put. Complications are rare, and it's a very nice device for those people that push shopping carts around, can't walk far and they have to sit down to relieve their back pain, and the back pain starts to go into their legs. That's called spinal stenosis with neurogenic claudication is the medical term for it. Okay, what do you see? Pain with walking and standing gives you the sciatica. Leaning over relieves it. Sitting relieves it. Those kinds of things do great with not only the nerve burns in the spine, but they also do really well with the Vertiflex. What kind of things do you see with it? These people can have pain in their hips when they're walking, front of the legs, back of the legs, but sitting down, leaning forward, relieving it is really key for something like this. Let's talk about the diagnosis of spinal stenosis. So if we're going to try to fix the problem at the source with the Vertiflex, we're going to go ahead and look at what the spine is when it gets sick. Once again, here's the side view. Here's a person walking, the side view, holding their back because it hurts. The nerves are starting to get pinched. Once again, here's the nerve coming out. Here's a nerve that's red because it gets pressurized every time it's pinched. And here's what, and right here is what looks like when it pinches the nerve. This is a sideway cut through this is a sagittal cut through the plane. So the axial view here, it's called, is a cut through it. So now you're looking down on top of the spine. The nerves have to come out on every level between these holes. And as they come out, they live in the spinal fluid freely and they float. When people get a lot of arthritis, and most of the arthritis comes on the back side, these joints right here, as well as the disc, which will push backwards, the hole, and that's the spinal area, gets tight. Stenotic, stenosis. So spinal stenosis. All you need is a little lifting of that to open it up. A surgeon, when someone has it very badly where they start to have weakness in their legs, will go ahead and cut out this bone right here, called a laminotomy or laminectomy. For pain doctors, as long as you don't have progressive weakness in your legs, we'll go ahead and put the Vertiflex in that same location to pop it up. And that Vertiflex works wonderfully for patients that have, once again, pain with walking. They have to lean over to relieve their back pain, and they sit down and they feel a lot better. That opens up this canal, and by putting a small device in the back here, that keeps the canal open. To review what the procedure's like, very small incision, go home the same day. You don't remove any bone or tissue. Recovery is pretty much you shower the next day, and then most of us are using sutures that are under the skin so they dissolve within the body. Infection is very rare. And if some point you came along and you said, I don't want this in my back anymore, you can even take it out. This thing goes in here, it goes ahead, and it opens up, goes in like this, and it opens up like this, which makes it so that you can go ahead and unscrew it, and screw it back down, and pull it out if someone didn't want it anymore, or if it became a problem of some sort. Removals are very rare. Satisfaction is very common. Some of the types of people you see. Most of them are like us, usually an older patient. Usually those patients are the ones that start to have other comorbidities, we call them. So if you came to me and you said, oh, every time I walk, my legs start to hurt, I would go ahead and do a few things. I'd go ahead and get your MRI scan, but I'd also check your reflexes as well as your pulses in your legs. One of the real chameleons with neurogenic claudication or pinched nerves giving you pain in the legs is vascular claudication, which is bad blood flow to the legs is giving you the pain. So those are some things you would come across if this is you. Make sure your pulses are checked and make sure you have good blood flow to your legs before you have something like a Vertiflex put in. Vertiflex won't change your pain if it's coming from your blood supply. And having blood supply improved won't change your pain if it's coming from a pinched nerve in your back. Some of the numbers, they're astounding. Patients love it. In this patient population, they quit taking medications. They're able to go do their things, and particularly walk a lot farther, and their leg symptoms get much, much better. Quite a device. If your spine meets those radiological problems, if your pain gets better when you sit, this is something that may help you. All right, we've talked about two things already. One, trying to fix the problem like a Vertiflex. Number two, stopping the pain at the source by burning the nerves. Let's talk about a real powerful device that can help people with chronic pain. Spinal cord stimulation is what's called neuromodulation. What is that? You're going to go ahead and affect the nerves so the brain doesn't have to have this constant barrage of pain. Pain has to go from your periphery into your spinal cord, then into your brain. Your brain has to process it as pain, and then you have that nasty cycle of waking up with pain, can't enjoy your life, can't do the things you want to do. You go to bed, you can't sleep, you do it all over again. This device right here has helped numerous people with complex problems by just stopping the signal of pain to the brain. It's called spinal cord stimulation. I use 4 different companies for this. This is one of my favorite companies for 3 reasons. Number one, I can get the neck and the lower back, arms and legs using one little battery. No other company can do that for me. I can go ahead and get an MRI scan with this device, as well as I can go ahead and put a battery in that doesn't have to be charged. You can turn it up, turn it down, use different programs, but it has to be charged. So I'm showing you Boston Scientific right now. It's one of my favorite type of batteries and systems to use, and we'll go through that. Who benefits best from something like this? First of all, you have to have regions of pain. If you come into my clinic and you circle the whole body of pain, or you color the whole body in, you're not going to get one of these. It doesn't mean you don't have that pain. It just means that you don't have too many regions for me to capture, even with the 4-lead or 32-channel device, which was on the previous page. Types of diagnoses that work best for this are neuropathic pain in the low back and legs. You see it very common that people have had back surgery before. People go, oh my God, I've had back surgery, my back still hurts, my legs still hurt. The surgeon says everything's great. You take a picture, the x-ray, the CAT scan, the MRI scan, shows everything's wide open. You shouldn't be hurting, but you still are. Those are things called neuropathic back pain or failed back surgical syndrome, in which you have this chronic pain. It's more of a nerve type quality than it is mechanical type quality. And nerve type quality usually works better than mechanical, but mechanical works pretty good with this too. It's great to have pain in the extremity, and this will take that away fairly easily, as well as in the back or the neck. Some of the diagnoses, which most of you don't even know about, like complex regional pain syndrome, which is a horrible nerve type pain that people get after an injury, where more than one nerve gets to be affected, and it makes it so you can't move your limbs. This device works wonderful on it. And if you are having chronic pain and it's severe, greater than 5 out of 10, and you failed other things like physical therapy, TENS unit, epidurals, or already had the ablation, then spinal cord stimulation can be a good option. When you're on a lot of medications, I would suggest not having a spinal cord stimulator until you get off those medications. And that's a real problem, because with the medications, people go, oh my God, I'm taking the most the doctor says I can have with medications. My pain is still a 7 out of 10 or 8 out of 10, 9 out of 10, 10 out of 10. Then probably those medications are becoming part of the problem instead of part of the help. At that case, you got to detoxify and then go ahead and have a spinal cord stimulator trial. Those patients do wonderfully. So spinal cord stimulation, it's been in use longer than I've been in practice. When I first started using it, we used to use 2 contact trials, and now you have the system right here, which is hooked onto the computer, which has, we use like 32 contact trials in order to have people get helped. It's FDA approved. It's not drug therapy. And the nice thing about that is that your body usually does not go ahead and become tolerant to it. Most patients do really well to begin with. There is a little bit of drop off at years 2 and 3, but that's being taken care of now, because each one of these little devices has so many programs in it. They're able to fool the nervous system so that if pain tries to make a different pathway, these things can be reprogrammed in a different way that makes it so that pathway cannot make it to the brain. The new improvements in technology have dramatically improved patient outcomes, and that's a fact. They've done everything from start to work just in the middle of the back, to more outside of the spinal area where the nerves start to first put their impulses in there, and even to the coverings of the nerves, something called glial cells, can be stimulated to help stop signals of pain to the brain. So this device is just flourishing for chronic pain patients, and it's very helpful. And you may find you say, oh my God, I've already had Boston Scientific and that didn't work for me. Or I already had a Medtronic one that didn't work for me. Or an Abbott or a Nevro. You may find the programming in different types are much different. And whatever waveform is hitting that nerve may be effective. So don't be surprised if your pain doctor once comes back to you and says, you know what? You failed this one with this kind of programming, but now either they have a new programming system out that's been helping a lot of people, or there's a even different company that has a different kind of programming that's available that can still help you. Okay, what's it do? Spinal cord stimulation is personalized. It goes into the spine, and most of the time we pretty much know where it has to go. But in some people, they go, you know what? My right leg's worse than my left leg, or I have more in the front of my leg, or I get some in my abdomen or my chest wall, and we will move stimulators to different parts of people's bodies. Right here on YouTube is one of the Boston Scientific animations on how it works. And I'm going to go ahead and play that for you.
If you live with chronic pain, you know how all-encompassing it can be. It robs you of the things you love to do. It strains your relationships. It makes even the smallest tasks unbearable. And no...
I lost you. I'll start that again.
Of the things you love to do. It strains your relationships. It makes even the smallest tasks unbearable. And no matter how many procedures you've had to endure, or medications you've been given to try, we know that one-size-fits-all therapies may not give you all the relief you need. Boston Scientific's spinal cord stimulation therapy is different. Spinal cord stimulation, or SCS, is a safe, drug-free, FDA-approved pain management therapy that's clinically proven to help reduce chronic pain. And with Boston Scientific's SCS systems, your therapy can be personalized to your unique needs and preferences. Here's how it works. When you feel pain in your back or leg, for instance, it's because nerves from that part of your body are sending pain signals through your spinal cord to your brain. It happens in a split second, so it feels instant. But the truth is, you don't actually feel pain until your brain receives a pain message from the part of your body that hurts. SCS is designed to interrupt those messages using a small electronic device called a stimulator and thin, flexible leads. Similar to a pacemaker, the stimulator is implanted under the skin where it generates mild pulses. Those pulses travel through the leads to nerves along the spinal cord and interrupt the pain signals en route to the brain. Most SCS systems replace the feeling of pain with something called paresthesia, a kind of soothing sensation that can reassure the patient the therapy is working. Other SCS systems produce no paresthesia. Boston Scientific's SCS systems offer both options, giving you the flexibility to choose from a range of sensations, or, if you prefer, no sensation at all. Boston Scientific's SCS systems can also deliver more than one type of stimulation at the same time, even to multiple areas, giving us a better chance of finding the right treatment for your particular pain. Results of a clinical study show that when patients can choose between multiple therapies in one device, they achieve better overall pain relief. Another great thing about SCS is that you can do a trial with a temporary system first to see how it works for you. Your doctor will position the leads in your back and then connect them to an external stimulator that's worn around your waist. For the next 3 to 7 days, you'll be able to test drive the device, experiencing what SCS feels like as you walk, sit, sleep, and just go about your life. Most people who try a Boston Scientific system feel significant relief. In fact, in a recent clinical study, More than 90% of patients who tried our system decided to go forward with the implant. Over 96% of patients said they would recommend Boston Scientific's SCS systems to other people suffering from chronic pain. In another study, patients with severe back pain reported an average drop in pain score of nearly 6 points, even 2 years after getting their Boston Scientific SCS system. The effective, long-term relief from chronic pain your Boston Scientific SCS system provides can help you reclaim your life and many of the activities you used to enjoy. Talk to your pain doctor about SCS. Learn about the benefits of multiple therapies and personalized pain relief from Boston Scientific. For more information or to find a pain specialist, visit controlyourpain.com.
So if you saw that, listen, you need to trial it first. Of all the things I've shown you so far, the nerve burning as well as the stimulation, both get to be trialed beforehand, which is phenomenal. Because if you don't get better with the trial, you don't have to have the permanent one put in. For most patients that have the permanent one put in, I want them to be as happy as 1919. That was the year that people invented sliced bread. You know, if it's as good as the invention of sliced bread, have the spinal cord stimulator put in. If not, don't get it. But the trials in which patients don't want to come back to the clinic to have the leads pulled out, which is a simple procedure, all you do is just pull the lead out, and the physician assistant usually does it because they're more independent, where they can say, "Oh, Mrs. Smith, Mr. Smith, did you guys like it or didn't like it?" It's not me saying, "Oh, did you like it?" So there's no bias at that point. It kind of decreases it. And at that point, you can go ahead and decide if something like that helps you. If you have a spinal cord stimulator trial, go ahead and make sure you can at least get 50% pain relief. I look for 70%. Get back to some daily activities. See if you can do it. See if your pain medications can be decreased. Pain medications are very difficult to deal with because sometimes you stop and you go through drug withdrawal. Sometimes you do have addiction to them and you don't think you do because you'll stop it and you'll crave it. So the trial usually is not the best time to get off the medicines, but you may be able to decrease the amount of medicines you take. And then see if your quality of life improves. Sleep, relaxation, see if it makes you better. As the video showed you, you'll get relief where you need it, when you need it. And you don't have to have it on all the time. You can have it on so fast, so quick in the back that you don't even feel it. And that kind of stimulation can stop pain fibers without affecting the muscle fibers or anything else that would make it so you can't do the things you want to do. And then they can go ahead and combine themselves from using the fast system to a slower system to a faster system. And before you know it, those nerves don't know what hit them. It's like Rocky Balboa taking on Apollo Creed. Safe and effective. Spinal cord stimulation, as you saw in the video, has been used for a long time. More and more companies are coming out with these devices. Some have fresh ideas, some don't. But the key thing to see is that you're able to take away severe pain. 8.6 on a scale of 10 is really bad pain, down to like 2.9. It doesn't cure people, with the one exception of possible complex regional pain syndrome, that one disease I talked about. But it does not usually cure people, but it really helps them manage their pain better. And it can be used long term, and it can always be taken out. All right. I really enjoyed being able to give you this talk. And if you'd like to talk more, of course, you can see one of our physicians, one of our physician assistants, even talk to your physician. Most physicians in both of our areas, where we see most of our patients down in Lenawee and Washabaugh County, know a lot about these things. But we're not the only clinic that implants these devices, but we are pretty much specialized in implanting these devices. And make sure your pain management gets you to do the things you want to do. You don't need pain management if it doesn't really affect you. You have pain and you're able to manage it yourself. But if you're the kind of person that all of a sudden can't do those things you like to do, then see your pain doctor.